Well, good afternoon, everybody. It is Thursday, October 22nd. This is the Washoe County Health Department board meeting. It is just a little bit after 1, and Commissioner, would you do the pledge for us, please?
Please join me in saluting the flag.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, ma'am. Okay, can we have a roll call, please?
Yes, Chair. Chair Novak,
Here.
Vice Chair Brown,
Here.
Commissioner Burpigler,
Here.
Councilman Dare,
Here.
Dr. Danko,
Here.
Councilman Delgado will be absent, Chair.
Yes.
Tom Young. Tom Young will be absent, but we have a quorum, Chair.
Okay, good. Thank you very much. Okay, we're going to move to the next section, which is public comment. I want to remind you all that this is limited to 3 minutes. And
We have first Raquel A. Dowd.
good. Raquel?
Thank you. I would just like to express I'm deeply concerned about the directives under Kevin Dick that is keeping middle and high school students from having the opportunity to have in-person learning as well as having full opening of all high school athletics. Kevin Dick did respond to my previous email questioning these decisions and said that he is not in control of the directives being made by the governor's office nor the decisions of the school board of trustees, and that he can only provide recommendations. So I would like to know what those recommendations are based off of, as there have been no evaluations done on the longer term detrimental effects on students, increased mental health issues, as well as the exorbitant number of increased student academic failures. Kevin Dick is pointing his fingers back at the governor and school district. The governor is pointing back at the school and health district itself, and the school district is pointing right back at the governor and health department. So I would like to know who is making these decisions and why there is no accountability for what is currently being done and not working. We as parents are being stripped of our rights to determine what is best for our children. And Kevin Dick is making life-altering recommendations unsupported by the CDC with no regard for the longer-term disastrous impacts on our children.
Is that the end of your comments?
Yes.
Good. Thank you very much for your comments. Moving to number 2.
Next, we have Mr. Chris Radohaffer.
Yes, I'm speaking today on behalf of my 2 boys in Monty Ranch High School and as a concerned parent. Ever since COVID started, we've been told to follow the science. Well, it's clear that the science is in. Earlier this year, 3 prominent scientists came out with the Barrington.
Did we lost you sound?
Yeah, can you let him know, please?
Chris? You're muted. You are muted.
Can you hear me?
Now we can hear you. Thank you.
Okay. So I'm speaking today on as a concerned parent. I have 2 boys at Monty Ranch High School. For all the other kids who attend Washoe County School District and student athletes, ever since COVID started, we've been told to follow the science. Well, the science is starting to come in. And so I ask you guys to take action and listen to the scientists who are producing facts and evidence of COVID. Earlier this month, the Barrington Declaration was released and signed by over 11,000 medical and public health experts, 30,000 medical practitioners, and over 500,000 concerned citizens. A couple things from that declaration. It says, current lockdown policies are producing devastating effects on the short and long-term public health. The results include lower childhood vaccinations, along with cardiovascular disease, fewer cancer screenings, and deteriorating mental health. Keeping students out of school is a grave injustice. And I would like to see that school go back to 100% in person and sports be allowed to resume. Furthermore, with the declaration, as I said, we've got a growing evidence and we understand what COVID is. We know that the vulnerability population is the older, not the young, not school-age kids. Indeed, for children, COVID is less dangerous than many other harms, including influenza. We got to figure as adults that there is calculated risk in everything we do. There's calculated risk when we put our kids on the school bus to go to school. There's calculated risk when we allow them to play the sports that they love. There's calculated risk when we all get up and go to work in the morning. But we can't keep our kids in a bubble. I'm here to ask that the health department allow the kids to go back to school so that they can get on with their lives. You don't understand that these children, at the age they are, their brains aren't fully developed, and they're not able to reason and understand fully what's going on. And a personal experience, I have a relative who has a middle-aged school girl. She's smart, she's outgoing, she's athletic, but since COVID and with all the news of death and cases, it destroyed her life. And I know that many other parents have been afflicted with this. And you guys need to wake up and allow our kids to get back into school. Protect those who need protecting, protect the teachers who need protecting, but allow our children back in school. And at minimum, allow the parents to have the power to make that decision what's best for our children, not public health officials.
Thank you, sir. We appreciate it. Okay, next.
Chair, we have Mr. Aguirino, followed by Wendy Damani.
I'm unmuted now. Can you hear me?
We can hear you.
Okay. I'm retired. I spent the last 24 years of my work life at a company called Cisco Systems, and I have a degree in mathematics. My role at Cisco was to analyze large amounts of disparate information and advise senior management on what I thought that data said. We made billions of dollars doing that. With that in mind, I'd like to make a couple observations about what I'm seeing with COVID and schools. I have not had the pleasure of seeing publicly a diligent consideration of the downside of not having children attend school. This includes mental health, inadequate learning, and some of the other things the other speakers have mentioned. I'll not claim to own them all, but I did see a suicide in the news today and a note that suicide in teens is at 200% in that particular city. It wasn't Reno, it was another city. My thought here is that I recommend you as executives need to be sure that you are considering all the data and not just the COVID dangers data. My kids are both recently graduated from Galena High School and they're in college. Both are struggling with depression and anger as well as keeping up with the materials. Considering their extra years and maturity, I can only imagine what this is like for junior high school and high school students without the preparation these kids have had with a couple more years of life. I'm not going to claim I know the answers here. I don't have all the facts. What I do know is that there are very serious problems with virtual school, and those problems could be well worse than the problems that might result from in-person school. To date, like I said, I haven't been able to discern from public officials, and this includes federal, state, and local school and everything else I've been seeing on the news, that you're considering the downside of the actions that they're taking to reduce the spread of COVID. So I'm not going to say, you got to open the schools. I know some of the other parents were saying that. But what I am going to ask is that I think you need to make it public what data you are considering and really do the math here. Make sure that you are taking into account that, if we stay home school, we save 2 lives, but if we do stay home, then maybe we have 4 suicides. So which is worse? So my ask is that you carefully consider the data on both sides. I'm finished.
Thank you for your input. I appreciate that. Okay, another one, please.
Yes, we have Wendy Damani, followed by Mr. Clay Murray.
Okay.
Hi, thank you. Can you guys hear me? I'm zooming in today to show my support to get kids back to school 100%. I'm seeing devastating mental issues with our kids that absolutely far outweigh the risks of them contracting COVID at school, which, by the way, research is now showing they are not contracting it at school. We are all heard on Tuesday, the governor says he wants kids back in class, but it's up to the health district officer and superintendents to make that happen. I know my school has a plan sitting on Kevin Dick's desk that would allow parents to choose to send their kids back or continue with distance learning, whichever they wanted to do. The plan is just sitting there. At my school, 80% of parents want kids back to school, but we aren't allowed to be parents at this moment. We aren't allowed to parent our children the way we want to because the health district officer has taken that power away from us. Your district board of health bylaws clearly state that the health officer reports to you. So how about directing Kevin in his evaluation today to direct him to move forward with creating a plan that makes schools safe for kids to be in. And then parents can choose whether or not they want their kids to go back to school or do a hybrid or completely stay home. It should be the parents' decision. Kevin Dick's 2018-2021 strategic plan clearly states to be flexible, adapt, be accessible, proactive, innovate, and create. Innovate a plan to get our kids back to school. Be creative so that parents have a choice. Your plan also calls to empower individuals. This should mean empowering principals to do the right thing for their students, which many believe is bringing kids back. Also, your plan calls to improve K through 12 outcomes, which we know is so closely associated with public health outcomes. And we know that kids being in class creates better outcomes. Finally, promote behavioral health. That is in the strategic plan. However, you're doing the exact opposite. Kids at home, that is making them feel depressed, sad, lonely, isolated, all the issues that we are going to see coming forward, which in other parts of the country we are seeing. Please, as a board, before approving a bonus for Kevin Dick because of all of his overtime, please ask to see a plan to safely get our kids back to school. Thank you so much for your time. I really appreciate the opportunity.
Thank you very much. Okay. Any more?
Yes, we have Mr. Clay, please. Clay Murray.
Yeah, how are you guys doing today?
Good.
Hey, so I have a son that goes to Bishop Manogue High School, and then I have a second son that's younger that goes to a charter school in South Reno. And so I'm just tuning in today. I'm actually pushing not only for the reopening of schools, but I'm also pushing for to let them play. And so I kind of want to just walk through just kind of some commonsensical stuff here. And I think, look, we all understand that you guys have a difficult decision and a difficult job. We don't doubt that at all. But we as parents also have one. And so, I just want to share, I come from a family of 12, and I have a sister that committed suicide and a brother that died of a drug overdose. And I received a really interesting email from a parent yesterday that works at one of the local hospitals. She's a emergency room physician there. And she shared a story with me about a 30-year-old lady who'd gotten COVID and had to be put on a respirator and was pregnant. And the baby also had to be put on a respirator. And certainly a sad story. It was one situation, I think, a very rare situation. I don't think there's a lot of pregnant ladies in there with COVID, but I could be wrong. But I thought it was interesting that she brought up a 30-year-old. And I just want you guys, I have a degree in statistics, and I like to do a lot of research. And so I've looked at Kevin's plan. I talked to Kevin the other day. I thought it was interesting. His stuff is back in July, and we're now in October, almost to November. So I thought that was interesting. But I want to walk through just a couple of common sense things here that I think would be a good solution. So Recently, I was out in Utah, went to a football game there, and I thought it was really interesting how they did it. So the first thing we had to do was we had to go in online to the school's website and apply and actually download this app that would then track us, which I believe we're using here in Nevada currently. It would track us in the stand and it would put our information in. That way they had a way to contact us. If someone near us had gotten COVID, then they could contact us. And of course, we had to wear masks to watch the game, and we had to social distance in families. And so they only let so many people in the stands. But it was wonderful. My son was so uplifted by it. I couldn't believe how happy he was coming out of the game. Fast forward now 3 weeks later, he's back down in the dumps because they can't play football and they're kind of practicing, I guess, if you want to call it that. And I think they, along with myself, feel like we have no voice and we feel like there's no real science. And I'm going to point to a couple of things. So I know the governor in his address a few weeks ago said that, well, the NCAA schools and the pros have the ability to test weekly. Well, technically, I would assume, and here's kind of the solution that I'm going to propose to this is, I do realize after talking to a few people that you guys are wanting schools to be fully reopened in order to allow sports. I'm not exactly sure why that is, and I've had no one really tell me that. But what I would throw
Sir?
out to you guys, yes.
I hate to cut you off, but it's 3 minutes.
Okay, I've been 3 minutes.
Yes, sir. It goes quick. Thank you very much.
Okay.
Any more comments?
We don't have any more, Reggie.
Okay. Thank you very much for all your comments. We will move to number 4, which is approval of the agenda. And I want to point out that we have pulled item C off the consent agenda at this time for further study and working on a little bit more. So that is not on our agenda today. So do I have a motion to approve the agenda?
So moved.
Okay, first and second, all in favor?
Aye.
Opposed? Hearing none, it is passed. Okay,
Chair?
Mr. Health Officer.
For the record, I just wanted to note that Tom Young signed on at 1:15.
Okay, good. Thank you very much. Welcome, Tom.
Well, thank you. I had trouble signing on. I
Okay,
didn't
good.
hear most of the comments, and I appreciated hearing them.
Yes, there are good comments, so. Okay, Mr. Health Officer.
Thank you, Chair Novak. Our next item is number 5, recognitions. And I'd like to begin with years of service. Want to recognize Jessie Silem, Office Assistant 2 in EHS, with her 5 years of service. She is the counter support person over at Environmental Health Services. Next, I'd like to recognize Kelly Parsons, also Office Assistant 2 in Air Quality Management, for her 5 years of service to the Health District. And she's also with the Counter Services in Air Quality. Lastly, for years of service, Scott Strickler. He's an environmental health specialist in Environmental Health Services. 15 years of service with environmental health. So congratulations to all of them, and thanks for all of their service to our community. Next, I'd like to recognize a recent promotion of Josh Storey, who's been promoted from a senior air quality specialist to an air quality specialist supervisor. Actually, I believe it's air quality supervisor, effective October 12th of this month. So congratulations to Josh, who's doing an excellent job there. And lastly, we have 3 shining stars that I'd like to recognize for their excellent customer service. Andrea Esp with her 3rd shining star. Samantha Beebe with her 10th shining star, and Mary Ellen Matzel with her 20th shining star recognition. So congratulations to those staff and to all the staff of the Health District for the excellent customer service that they provide.
Good. Thank you. Congratulations to all. Thank you very much. Moving on, item number 6 is the consent agenda. Is there any of the board members that want to pull anything off the consent agenda to discuss? Do I remind you that item C has been pulled from the agenda, so.
This is Christopher. I move to approve the agenda as it is.
Thank you,
with
sir.
that pulled off. Thank you.
Do we have a second? Second, got a first and a second. All in favor?
Aye.
Any
Aye.
opposed? Hearing none, that has passed. Consent agenda is approved. And now down to Mr. Dow for Regional Emergency Medical Services Authority. Mr. Dow.
Good afternoon, Mr. Chairman and members of the board. My name is Dean Down, President and CEO of REMSA and CareFlight for the record. You received a copy of our September compliance report for your review, and I'm available for any questions that you may have about the report.
Any board members have any questions? Any comments for him? Hearing none, can I have a motion to approve his report?
I'll make a motion to accept the report.
Good, first. Have a second?
Second.
Second, okay, somebody's got a second. Terrific, thanks, guys. All in favor?
Aye.
Opposed?
Aye.
Hearing none, it is approved. Thank you, Mr. Dow.
Thank you.
Alexa?
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA for the record. You have for your review the Public Relations Report for September. Today, I will give you an update on a couple of our more recent activities. At last month's meeting, I reported that we had just launched our homebound flu vaccination program in partnership with the Washoe County Health District. As you can imagine, it was incredibly popular. We are working through a waiting list and the program is currently closed for this year. We look forward to offering this important service again next year. Another update from a report last month, the segment produced by Aging and Awesome, a locally produced television program that airs in Northern and Southern Nevada, aired earlier this month and offered an outstanding explanation about our tiered response system and featured one of REMSA's EMS supervisors, Monica Teeves. You can find the 5-minute segment on REMSA's website in our news and updates section at remsahealth.com. In addition to October being Breast Cancer Awareness Month, it is also Sudden Infant Death Awareness Month and Sudden Cardiac Arrest Awareness Month. For tips on infant safe sleep and to register for CPR classes, you can visit remsahealth.com. And finally, we've been able to open up our ride-alongs on our community healthcare vehicle. All of you are invited to schedule a time to ride out for a couple of hours with Advanced Paramedic and Executive Director of Integrated Health, Adam Hines, and learn more about how this special resource is supporting the EMS system in our community. We were happy to have Councilman Dare join us recently, and I know that Dr. Danko is scheduled to ride along soon as well. And I believe we're coordinating with a few other of you around your schedule. We look forward to having you. I'm available to answer any questions you may have about our public relations report.
Thank you. Any questions?
I just have a comment.
Sure, go ahead.
Yeah, and I'd encourage all of us to, with all the conversations we're having, it definitely was a pleasure to go, and they did a great job, and I see the value in what they're looking at, and so it's one of those things, continued conversation will only help us to have an idea of what it is we're actually talking about as we continue conversation. So health board members unite, go REMSA.
Okay. Any other questions for Ms. Jobson? Hearing none, thank you very much, Alexa.
Thank you.
Okay, moving right along to item number 8. This is a report from Ms. Griffey on the evaluation of our health officer that we do annually.
Hi, Lori Griffey, the HR rep for the Health District. We're just following up with the results from Mr. Dick's annual evaluation. The evaluation survey was distributed to 31 participants. It was approved by the board last month.
Lori, a little closer.
The survey was distributed on September 25th and closed on October 7th. We sent it to 31 participants. 21 people actually participated, so we had a 68% participation rate. The overall, Mr. Dick has a 90.51% meet or exceeds expectations, and he has a 9.49% area of growth. There are comments that some of the participants put on the survey. They have been included in your packet. And our recommendation is that the board accept the evaluation as presented. If the board would like to set any recommendations as for future goals for the district health officer, we can include those for his goals for next year.
Good. Do we have any questions for Ms. Griffey? Okay, hearing none. how many people from outside employment here that have association were sent out?
How many participated?
Yeah, the people that deal with the health district, but not directly employees.
We had 16 from outside agencies participate, and then we had the remaining were direct reports of Mr. Dick or the board.
Good, thank you. Okay. Yes, ma'am.
Thank you. I actually don't have any questions for you, but I do have a couple of comments and questions for Mr. Dick, but I'm going to hold them till we get to item 10.
Okay,
Okay.
very good. Okay, do I have a motion to accept the report and recommendation?
I'll make the motion to accept the report and recommendation.
Okay, we have first, second? And a second. Okay, thank you very much. We have first and second. All in favor? Opposed? Okay, thank you very much. It's passed. We'll keep him around for another week or so. Very good, thank you. Okay. Item number 9. We have staff reports. Okay. Mr. Vega, are you there?
Yes, Mr. Chairman, can you hear me?
Yes, sir. Go ahead.
Perfect. Francisco Vega, Director of the Washoe County Air Quality Management Division, for the record. I don't have anything to add beyond what has been reported in the staff report, but I'd be more than happy to answer any questions.
Okay, thank you. Do we have any questions for Mr. Vega? Hearing none, we'll move right along. And Ms. Lottridge.
Good afternoon, Lisa Lottritz, Division Director for Community and Clinical Health Services, for the record. I just wanted to let you know, so far this flu season, with flu vaccine, we have distributed 2,681 doses of flu vaccine. 2,229 of those have been at off-site clinics, which we're doing approximately 3 to 5 per week. And then 452 of those doses have been in our clinic. I have nothing else to add to my report, but I'm happy to answer questions.
Good. Keep up the good work on the flu vaccine. We'll all appreciate that by the end of the year. Thank you very much. Okay. Mrs. English, can you do the report today?
Yes, good afternoon. For the record, Amber English, Acting Division Director for Environmental Health Services. I would just like to give a brief update on the staff efforts regarding NAC 447E or the SB4 bill. So since the last meeting, staff have drafted public accommodation regulations to include the new COVID-19 requirements as part of NAC 447E. Those regulations, the draft regulations, are posted on our website for review. They have held 2 public workshops, one yesterday and one today via Zoom, regarding the regulations. The notice of proposed change or the business impact statement is scheduled to go to the board on November meeting, and the public hearing for possible adoption of these regulations would go to the board December 2020 as well. And then all impacted facilities were also noticed of the workshops and the public hearings. Staff did begin conducting the inspections for NAC 447E the week of October 12th. We had 4 teams of 2 staff members each that were able to complete inspections at 4 of our properties. Average inspection time was about 3 days per property. The inspection reports were obviously developed as well as a field guide to help assist staff with consistency when they're doing those inspections. They have been meeting regularly since they completed those, just to make sure each team is consistent in their interpretation of the regulations, just because this is kind of a more difficult regulation with references to SB4 as well as back to the NRS. So they've been meeting and they will complete those inspection forms and be noticing the affected properties probably either today or tomorrow or possibly early next week. So that's all I have in the report, and I'd be happy to answer any additional questions.
Any other questions for Ms. English? No?
This is Tom Young,
Yes,
board
sir.
member. Amber, I was, I'm sure that you have been pulling through lots of different vague interpretations as the the conditions change drastically, and I do understand, understand, especially a lot of businesses are affected by all of these and things too, and some of the inconsistencies. But has there been some like consistency with talking to the Southern Nevada Health District in terms of some of the interpretations so that possibly we can move through these and be more consistent?
Yes, absolutely. So the staff has actually been in communication with both Southern Nevada and the state in all of the agencies that are affected, so including gaming control and business and industry. So we have definitely been consulting with other partners as well.
Okay, sometime I think it would be maybe to summarize some of these more vague items and things at one time when we can get our feet back on the ground too. But it's been, I'm sure, extremely difficult, your staff and us business owners also, so, and the public. So thank you. Good job so far though in doing that.
Thank you.
I got a question, John.
Yes.
Amber, I got a question. This is Mike Brown. When you mentioned properties, these are casino properties that we've had the 4 inspections done on?
So 2 of them didn't have a gaming floor, but they're resort type properties, yes.
Okay, and how many, I don't know if this can be answered now, but how many inspections or properties are we gonna have just here in Washoe County that we have to inspect?
I believe the count was around 75 properties. Not all of those would require the twice, the every other month. Some of those will be quarterly. And I want to say there was 12 to 14 that are required every other month.
Okay, and average was about 3 days to complete inspections?
Yes.
Okay, are
To
we
get through
looking
the entire, sorry, go ahead.
as time goes on, do you think we'll be able to narrow that down to a shorter period of time, or?
I do think that, yes, part of the issue with the timing also has to do with the staff of these properties not all being aware and being available at the time of the inspection. So they may show up at a particular area of the casino where they may deal with one manager, one person that's in charge of one area, but then when they need to move on, they need to be able to find the next representative. And a lot of times the information hasn't trickled down to that level yet as well. So I think as awareness grows, I think that'll help with the efficiencies of the inspections as well.
Thank you.
Any other comments or questions for? Thank you very much. Appreciate it.
Thank
you. Okay. Now, Ms. Epps.
Hi, Chair and members of the board. Andrea Est, Acting Division Director of Epidemiology and Public Health Preparedness for the record. Before you have my report. I have nothing to add, but I'm available for any questions that you may have.
Do we have any other questions or anything from Ms. Andrea? Okay, calling in from home. Thank you, ma'am. Okay, we are down to Mr. Dick, Health Officer.
Thank you, Chair Novak. We continue to experience high numbers of new daily cases and high rates of transmission in the community. As of Tuesday of this week, we hit our high of about 127 new cases per day over a 7-day rolling average. So that's causing us to fall behind with the disease investigation work just because of the volume of quantity of cases that are coming to us on a daily basis. We do have a designated number of each of the disease investigation team staff that are dedicated to the disease investigations of pediatric cases as a first priority. And so we're working to try to expedite those disease investigations as quickly as possible so we can both communicate to the students or staff as well as to the schools regarding isolation and exclusion of close contacts. I did provide the report to the state task force, and the task force met this morning. So the number of school K through 12 children and school district staff over the last week that tested positive was 70. So that's an increase week over week. I think the good news is that the number of UNR students was 34 over the last week. And so we've seen a reduction in the number of the student cases. So I'm grateful and supportive of the actions that President Sandoval has taken there with his Protect the Pack initiative and his movement to close the fitness center based on the number of cases they'd had that had been there, and not opening up the football game for full fan spectators this coming weekend. So I think we are seeing some impact of that. And from what I've heard from the disease investigators, they're not hearing of so many of the students that are attending social gatherings, but they think that this may be more related to the students that are out and about and going to their employment workplace and being contaminated or infected just because of the number of cases that we have in the community. So we're seeing a lot of community spread. Because of that, I did make the decision to not open or approve plans for larger gatherings over the 250 that were indoor events. And we did have a discussion with the task force this morning regarding that. And both Chair Cage and Director Reynolds of Business and Industry expressed their support for that action with not allowing those larger events based on the number of cases that we had. There were some comments from Chair Cage regarding an interest in us working with the jurisdictions on what levels, what kind of triggers we might be ratcheting down on event sizes that would be occurring within the region. As far as our operations go, we're continuing to operate the post, and we're able to meet the demand for testing with the Monday, Tuesday, Thursday, Friday post operations that we're doing at the Livestock Event Center. That's our point of screening and testing, the post. And that allows us to operate pods on some of the Wednesdays. So we did have the flu pod operating there yesterday. With the winter weather approaching, we will be moving the post over to the west side of the Livestock Event Center in early November. So that'll put it back over where it was when we first started out, and that's better for more sunshine, better drainage, less ice, those types of things. So that's in progress. Continue to be grateful for the guards' support and participation, both with the testing, the call center, the disease investigation work, and certainly they're quite helpful when it comes to moving things around like that as well. So glad to have that support. We are, as Lisa mentioned, working hard to get the flu shots in people's arms through the pod events and also through our clinic operations. We are working with the state on the plans for being able to dispense the COVID vaccinations once those become available. So I think that's the overview that I have on the COVID-19 response. As far as other important items, we're working on getting our annual report pulled together for submittal to the Public Health Accreditation Board as far as maintenance of our public health accreditation. And my Office of the District Health Officer staff are also busy working with our community partners to update the Community Health Improvement Plan and lay out the objectives for what we're trying to accomplish with our community partners for next year. And we'll expect that to be coming to you before the end of the year for approval. And we'll have a report sometime early next year on what was accomplished through the Community Health Improvement Plan over this year. So with that, I'd be happy to take any questions.
Yes, Commissioner.
Thank you. Mr. Dick, what's the percentage of students to staff of the Washoe County School District that you said there were 70 new cases?
So the The total of K through 12 students, not necessarily all in Washoe County School District, could include some private school students. We had
But in Washoe County.
61 students in Washoe County over the past week. And we had 9 staff members.
Okay. And I'm hearing that they're not actually getting it at the schools. I'm hearing that from a number of different people as I am out and about talking to constituents, and that the sense is that the students are really bringing it to school. They're not getting it from school.
I don't know that we have confirmed a case that was transmitted within the school, but we do have, earlier this week, the statistic that I heard was 111 students so far this year that had been confirmed positive and had attended school while they were infectious.
And so of those students that have been confirmed positive, any of them been in the hospital? Any critical problems?
I don't have that information, but
Okay.
I can track it down for you.
Okay, just curious. And then, would you say that we are in our third spike?
Yeah, it's sort of. We haven't had like really distinctive spikes, unfortunately. What we seem to be doing is climbing
A lot of this
climbing
stuff.
the stairs, because we'll have a surge and it'll peak, and then we'll get a little decline, it'll flatten out, and then we'll go up even higher than we were. So what we've seen in Washoe County is really quite significantly different than what has occurred down in Clark County, where they had a bigger surge than we've had, but then they really came down fairly steeply on the other side of it and really had a big reduction in the case counts. Unfortunately, we've never had a really big reduction following the increases that we've seen.
Yeah, okay, good. I'll save my other questions or I can ask them now, whichever way.
You got the floor, go for it.
Oh, okay, all right, well, I will ask the question. So constituents say a lot to me, and people who were on today, and all of these are from people who are saying that we, this board, and you specifically as a health officer, need to do something about reopening schools fully. I absolutely agree that children need to go back to school. I think it's for their psyche kind of dangerous not to have them in school. Now, and I say that when I have a granddaughter who is a school teacher of middle school students, and she's married to a guy with very severe MS. So, we spend a lot of time worrying about protecting him, and she's in the school system, but even still, as a teacher, she also believes the kids need to be back in school. So having said that, it's my understanding that the current plan was not devised by you, Mr. Dick, but was devised by Washoe County School District. Is that correct?
That is correct.
And so did they come to you and did you give them advice to do it this way?
I did not tell them to do it this way. When they were making their decision about whether to reopen or not, they asked for a recommendation from me.
Yes, and as I recall, that was don't.
That was don't, and I laid out the basis for that, and it's part of the public record on the school district's board site for that meeting, and that was based on a number of different school reopening criteria that had been developed by the Harvard Global Health Institute and others. But they decided to proceed, and they proposed the in-classroom, full in-classroom option for the elementary school students and the hybrid learning model for the middle and high schools. We were involved and in consultation with them while they were developing their plans of how they would take these mitigation measures to try to help to prevent the spread. And I was appreciative that they did consult with us on that, and I think they did put together a fairly good approach for that.
And so I would say that I think it's your job as the health officer to make sure that you make decisions based on health care. But I also think that the parents of these children who are not able to go to school are looking at it not just from their physical health care, but also from their social and their mental stability health care. And I think that's a valid argument. Is that an argument that you would take into consideration to try and work with Washoe County School District to develop a different plan? Are you working on that
Yeah,
now?
when I did make my recommendation to the school board, I acknowledged that this was a difficult decision to make for them, as well as myself, but for them. And I acknowledged that I had some statutory responsibilities under state law for trying to control and prevent the spread of communicable diseases. But I did acknowledge that there are a number of factors that are involved in this decision that are outside of that have to do with, you know, mental health issues, social issues, even, you know, the ability of parents to be able to work, those types of things. So I acknowledge that it's a multifaceted decision that the school board had before them, and they decided to make that decision.
So what's the national standard that we're seeing in states like Nevada where we are continuing to see an increase in the disease? What's the national standard as it relates to schools? I mean, I always think it's important that we look to see what's going on elsewhere.
Well, I think that what we've seen are there have been a lot of schools that haven't opened at all because of the rates of disease transmission, and we've also seen schools that have closed because of the rates of disease transmission and positivity rates.
So it's kind of across the board of different ideas.
So, for instance, yesterday I saw that the Boston public school system closed, and that's because their positivity rate had risen to 5.7%.
And what's ours?
Ours is 8.5%, and we haven't been down to 5.7% since before the schools ever opened.
So then let's talk for just 1 minute, and board members, I hope you don't mind, but I think this is a good discussion for the public who are on here to kind of get a feel for what the issues are that we're trying to look at. As I understand, high school sports are controlled by NAII or in whatever, that group.
The Nevada Interscholastic Athletic Association,
Yes.
NIAA.
And they're the ones that have made the decision not to allow sports. Now, the county, so from the perspective of my county board as a commissioner, we have opened our county facilities, and teams that are not tied to the school are in fact using those facilities. But the school district teams are not controlled by us. They're controlled by this youth sports group.
Yeah, that's correct. So, but other youth sports organizations outside of the school district, under Governor's Directive 34, can have their teams practice, and they can have tournaments beginning on the 24th with approval of their plans from business and industry if they're going to have a tournament.
Yeah, that's my understanding from the commission. Those were the things that were brought to us.
That's for the non-high contact sports.
Yes. Yes, so you still can't play football.
Correct.
But is that because of you, Kevin?
No,
Are you the one that's stopping that?
No, and I didn't even have any input into
Okay.
that.
So I guess my point is I am totally with the parents who were here today. I completely agree, but I think the frustration that I have as a commissioner is the inconsistency in the direction we are allowed as elected officials and as boards who oversee certain areas within this county. There's great inconsistencies. And now that the weather's turning cold, I don't think this matters. But as an example, we've had a cap on how many people could go into a meeting, but not a cap on the water park. So there's been no cap on the water park. So that seems to me to be a really major inconsistency. I guess maybe the theory is you can't get COVID through water, but I disagree with that theory. So, I think those kids are touching each other just like kids on a football field would be. That's an inconsistency that doesn't make sense to me. And so I feel for the frustration of the parents and the kids and the teachers. I feel for their frustration, but trust me, you are no more frustrated than we are. And we have to try to figure out how to work our way through this field of craziness and resolve it. And so I guess what I would ask of you, Mr. Dick, is that you do continue to work with the school district and with the NA or whatever it's called, NAIA, I think that's what it's called, isn't it?
NIAA.
NIAA, oh, well, whatever. Anyway, I work with them to try and see if there isn't a way as we start moving, hopefully out of this third spike that we're looking at right now, as we start moving out of this, if there's not a way that we can find to get these kids back to where they need to be, because they really don't like staying at home and they don't do well there. So thank you, and I appreciate other board members. I appreciate you giving me the opportunity to kind of talk about this, because it really is an issue that I think is hitting all of us. I know I get lots of calls, as I know all of you do, so thank you.
Thank you.
Thank you.
Chair Novak?
Yes. Yes, sir.
Thank you. I have a few things I want to share too. One of the things that.
Excuse me, Chris, just a minute.
Yeah.
So I just want to caution, as I've listened to the direction of the discussion, I know we're talking about the director's report and it includes COVID response. I want to be very careful in cautioning the board that we don't get into a detailed discussion about what was raised in public comment regarding the schools and the health district's involvement in decision-making about the schools, because that has not been agendized. I think a general comment about the overall director's report is appropriate, but I'm very concerned about any further board discussion on this topic without it being properly agendized and noticed for a future meeting.
Thank you, ma'am.
Fair enough. I do understand that. So, for me, what I mainly, and all this would hit on this, I think one of the things that I need to know, somebody who's a director of what I'm a board of is there to help represent me and our city and what we do. And I need to know that's happening. Part of it is, you mentioned even about events, and we've spoken back and forth, but I'm not comfortable with what you said necessarily. And I say that if somebody has a plan that's a business, even if it's indoors, those places are big enough with the proper plan. It doesn't make any sense to me. We are creating potentially another health crisis or multiple ones by trying to take care of one health crisis. And I need it to represent us as a group. So I need to know that things are coming to us, and maybe you need to bring things to us in conversation. Maybe we need to meet more often. I don't know the right answer, but I can say the last thing I want are strong recommendations going out that make it seem like those are coming from me or our city, and they're not. And so let that be said, let it be known, and I think that that's hit on note of what we're talking about. And I do, and we'll talk more in another agenda item about maybe some things we can bring back to the board. Thank you.
Okay. Thank you very much. Moving on to board comments. Is there any other announcements, reports, updates, or requests for information or topics for future meetings? Hearing, yes, ma'am.
On a topic for future meetings, I think Councilman Dare makes a valid point. Maybe we should put just an open discussion on the agenda about reopening schools and how we can maybe facilitate or help in some way as the health board, help the schools to work through this process. So maybe that would be an item for a future board meeting.
Okay, good, thank you. Any other comments from board members?
I just have one, Tom Young here too.
Yes, Tom.
Question, I understand that Las Vegas schools are still closed. Is there anticipation of us having any sort of opening in the near term in Las Vegas?
Okay. Tom, if you don't mind, you'll need to call, Mr. Dick and talk to it directly. That this is not for, this part only can be for board comments and future items, so.
Well taken, will do.
Yeah, sorry, I hate to do that, so. Okay, Anything else?
Yeah. So with schools, that's one conversation. So I would like put on the agenda a conversation regarding events then, if that's the case, if that's the best way to do that. Because it needs to represent us when he's walking out there. Thank you.
Okay, thank you. Anything else? Okay, hearing none, I want to thank you very much. It is 1:57. I will adjourn the meeting. Yep, hold on. I'm sorry. Public comment? Anything else?
We do not have official registered public comment, Chair, but I'm not sure if about people. who want-
This is Jenny Wilson. I would love to make a public comment if now is the time.
Okay. Go ahead.
Hi, I did send an email, but maybe it wasn't received. My name is Jenny Wilson. For the record, thank you for letting me comment. I'm making this comment as a parent, but also as a doctor. I have two sons who attend high school in Reno, and prior to the pandemic, they were very active in sports, both organized and informal. I completely understand the importance of athletics to one's quality of life. And like others, I am going crazy having my kids at home half the time or more, having them bounce off walls because they have no sports to turn to release their energy, and no teammates who are constantly around to occupy their afternoons and evenings and weekends. And the kids are fed up as well. And I think that we all get it. I think that we all wish it were different. I work as an emergency room physician in Reno. I'm the medical director of my group. And I just want to give my perspective. And the most important thing I have to say is that I do not profess to know the answer at all. But in the emergency department, we're taking care of a higher and higher number of COVID positive patients every day. And as we all know, there's currently more than 1,500 active cases in Washoe County, which is the highest number since the start of the pandemic. And some of these people, as you know, also are critically ill and they're on ventilators. And even the ones who aren't critically ill, they feel absolutely terrible at the very least. And the ramifications of their conditions may last for months. So I just want to say that I'm concerned. I don't know the answer, but I'm concerned about an unrestricted return to sports. I think if kids existed in a vacuum and they never interacted with anyone other than their teammates and coaches, I would absolutely be in favor of letting them play, but that's not how our lives work. And even if we as individual parents are okay with the idea of our particular child risking contracting COVID, maybe our kids' teammate's mother on her chemotherapy for her breast cancer is not. And she can't be the victim of our choices. Ours is a communal society, and we're all interconnected, for better or for worse. So our actions and our choices affect the lives and the health of others, and we can't deny that truth. This isn't anybody's fault. Nobody owns COVID. I don't really think this is necessarily a matter of, writing the senators or showing up in force at public meetings, because I bet everybody on this call wants full-time school and full-time sports. We are not in disagreement at all. We have the majority vote. It is unanimous, but that doesn't change our circumstance. And I think as powerful and effective as Kevin Dick is, he has no control over the pathophysiology of the virus. It's just science, and he is our public health officer. So wishing the pandemic didn't exist or asking our community leaders to make exceptions which ignore its reality is not an effective way to take care of ourselves, our children, and the more vulnerable individuals in our community. And I'm really not just talking about the elderly and the infirm. It is not just them. COVID-19 is here, and for many people, the disease has created a much grimmer circumstance than missing a senior football season.
Dr. Wilson?
I don't know the answer. I thank you guys for working together.
I thank you very much, and I appreciate your comments. Any other public comment?
Yes, in an effort to do that, Bill, it says Bill's iPad. He raised his hand to make public comment. If he wishes to speak, he can unmute himself.
Okay.
This is Bill Smith. Hey, Clay. Are you able to hear me?
Yes, sir.
Great. And I'm calling in as a parent of two high schoolers in Washoe County as well. I wanted to comment just on what we just heard. you know, it's a little short-sighted that our kids aren't involved in a number of things. Not only are my kids at high school, but they've been working at Home Depot through the entire COVID process as a part-time job. And people are working in grocery stores, and people are working all over in the community, dental hygienists. And so this idea that we're going to protect people by locking our kids out of school and out of sports is just an absurd offer on its face value. But Mr. Dick, I'd like to speak with you directly. On March 31st, you stated for the in a call that the Reno Gazette-Journal picked up, and in preparation for worst case scenario, quote, how we decide who gets care and who doesn't. That's a very difficult choice, and there's many ethical considerations in that. And you went on to say that you expected between 120 and 3,800 deaths in Washoe County. So let's just fast forward. There's been 189 deaths. Thank goodness, one is too many in Washoe County. Almost none of those deaths affect children up to the age, really almost all the deaths are over the age of 60. And so let's fast forward today. You know, back then, you're not an epidemiologist, you're not a doctor, and yet you're setting the health criteria. And back then, I'm going to give everyone grace, this entire board grace. We didn't know. But fast forward today, on October 1st, you said you want to keep Washoe County shut down. And yet we have the realization we have less than 200 deaths. And almost no deaths in high school or elementary school or school age or people under 60 years old. So do you know that last year 480 people died of the flu in this age group in the United States? That's 5 times as many have died from COVID. So the flu should shut us down. Or how about the 771 cancer deaths in Washoe County in any given year? That should shut us down. You're 6.5 times more likely to have gone, if you're a child, to have gone to the doctor up to age 20 for the flu as you are from COVID. So what we've created in treating COVID is something far worse than the disease. And crime, depression, drug abuse, alcohol abuse, teen suicide, unwanted pregnancy, and you've locked these kids in their damn houses with no other options or outlets. So this is just a very wrong move. I think that was Mrs. Burkbigler. I don't know you, but I thought your questions were going exactly in the right direction. What is unique about Washoe County? We have cattle in the middle of our town, and you cite a school in Boston is shutting down. We're nothing like Boston. We're like Montana, and we're like Idaho, and we're like South Dakota, and we're like North Dakota.
Thank you, sir.
And I would really like this board to be responsive to the parents.
Okay, 3 minutes are up. Thank you very much. Any other comments?
Yes, we have Mr. Clay Murray wanting to comment.
Okay.
Yeah, I just want to kind of finish my thoughts and
Thank you.
in response to Jenny as well. So I think the thing that we're maybe losing sight of here is we're not talking about lockdowns for us as adults. Jenny referred to them. I'll refer to them as people that are high risk. And what's interesting about all this, and what I thought was interesting with Jenny and her email to me, was my answer to her is really simple. It's I would follow the science. And unfortunately, that's not what's happening right now. I thought it was interesting. Kevin and I talked the other day, and I thought it was interesting today, Kevin. I think for a meeting like this, and maybe you weren't aware that we were all going to be on here, so that's fine. But I think it'd be pretty important to see what you were asked earlier today, those cases of 61 that you mentioned last week that were in high school. Were any of them hospitalized? Were any of them, did they go anywhere? Or did they just get sick? I've had friends that have got COVID, and they said it was like the flu. They lost a couple things. But I really want us to follow the science. And here's real quick, and I'll end on this. Here, to me, would be a good solution. Why not have the football players and the sports people learn from home? That way, the only ones they're coming in contact with are their own families, as well as other people on the team, and then they can play. Why not let them do that? I think we're, again, overlooking all of the unintended consequences of teen suicide and mental health and all of those issues that are going to come in the future that we can't even see right now, for something that, I'm sorry, the science does not back up that this is affecting the high school kids. And I'll leave it at that. I appreciate you guys' time.
Thank you very much. I appreciate your comments. Anything else?
We do not have anything else, Registrar.
Okay. Hearing no other public comments, I want to thank everybody. Thank you for the board. We've had lots of interaction this week. The comments are good. The concerns are amazing. People trying to take care of people. This is an absolutely horrible time for all of us. And I express that very sincerely. We've got kids that are home. We've got suicide rates. We've got older people that are vulnerable and are not going to make it through that. And the school-age kids I do. But I want to thank everybody for their presence, and we are adjourned for today. Thank you very much. Okay.